Hello, my name is Dr. Al Peters. I'm the medical director for the Center for Anti-Aging Medicine and Hormone Wellness. Thank you so much for attending our webinar today on women's sexual health. Over the 30 years that I've been a gynecologist and caring for women, one of the most common problems that I encounter with women are sexual health issues, things like vaginal dryness, painful intercourse, loss of libido. And sadly, this trickles into affecting relationships. Well, we are so fortunate today to have with us Jami Derr. Jami has been involved in clinical care of patients for over 30 years. She's a well-known esthetician in the area, and her passion is women's health. So I'm going to turn this over to Jami now, and I hope you enjoy the webinar, and we're very happy that you are with us. Jami, thank you so much for being here.
Thank you so much, Dr. Peters. So we are so lucky to have Dr. Peters in our area, that we have a hormone specialist like him in the Lehigh Valley. Really, we're very fortunate. Not everybody has that in their area. So first, I want to make sure I tell you before I forget that we have a wonderful giveaway today. Let me show you. So we are giving away a vFit device along with all these complimentary products. So one lucky person will win this today just for showing up at this webinar. This is a $500 value, and we will let the winner know tomorrow if they are the lucky winner. Okay, so as the practice's sexual wellness consultant, I promote embracing conversations about sexual wellness and libido, as they are natural parts of our life and they deserve attention without shame and stigma. Ladies, the bottom line is we should all feel good in our bodies. And I'm really happy to bring you this information today because this vFit Plus is a really great option for an at-home treatment for vaginal dryness, pain, and more. I discovered this device when I started experiencing issues of my own, and I was age, I thought 50, but my husband reminded me that no, he thinks it was more like 45. So somewhere between the age of 45 and 50, I started having dryness and pain. I was really taken off guard by this because I didn't expect that at that age. I don't know. I thought that's something that might happen to a woman at age 65 or 70. So I was so clueless about this. And I think a lot of us, there's so much information we don't know because no one tells us anything. No one talks about this. Our mothers don't talk to us about this typically, or anyone else, unfortunately. So much to my surprise, sex had become pretty much unbearable. And at such a young age, I didn't want to accept that. So I started seeking out things that I could do. I'm a seeker of knowledge. If I have an issue, I'm always going to look for a way to resolve that. And I found the vFit device, and I'm so glad I did because it totally transformed things. And so I hope that you listen to this information and consider it for yourself because, ladies, it really does work. And I've heard this from a lot of other people that I have referred to this device as well. So are you avoiding sex due to discomfort? Or worse yet, are you tolerating painful sex? That is not okay, and we really want to rectify that for you. And my goal with everything I teach you is to help you have your best sex life for as long as you so choose. Because honestly, ladies, sex does not have to end at menopause, and it shouldn't if you don't want it to. So what is happening to our hormones during perimenopause and menopause that are creating these issues of pain and dryness? First of all, let me just say that perimenopause can start as early as in your 30s. Perimenopause can be about 10 years before you actually are in menopause. And then menopause is that day when you haven't had a period for a year, and now you're going to be in postmenopause. So this device is going to be good for perimenopause and menopause because what's happening is as your estrogen starts to fluctuate and ultimately deplete, you're going to start experiencing possibly genitourinary symptoms of menopause. 84% of women will experience this condition. That's a lot of women. And so we call this GSM for short, genitourinary symptoms of menopause. And what they can include are dryness, irritation, and burning of the vagina. You can have urinary symptoms like pain with urination, urgency or recurrent urinary tract infections. You can have changes in your vulva tissue, which is your external genitalia. You can have thinning of the vaginal lining, and the vagina becomes less elastic, and that can cause discomfort during sex. You can have sensitivity and pain at the vaginal opening. And a lot of times, if you think about your vagina as a clock, 12 o'clock, 6 o'clock, a lot of people have pain right here at that 6 o'clock spot. That's really, really common. And then also you can have a lack of blood flow, and that decreases sensation and libido. 40% of the 84% who will get these genitourinary symptoms in menopause, 40% will experience pain with sex. So ladies, you're not alone if this is your situation. There's nothing wrong. You're not broken. And you deserve to have answers to figure out what to do for yourself. I talk to women all day long in my skincare practice, and I hear things like drink a glass of wine and just endure it. That is not the right answer because your pleasure matters too. Or I hear you should just age naturally and this is part of aging. I don't accept that and you shouldn't either, okay? And I would love to see more women talk about what they're experiencing so we can empower each other and teach each other what to do in menopause to live our best life and feel our best. So what is this vFit Plus that we're talking about today? It's an at-home, non-hormonal rejuvenation device that is going to help with revitalizing the vaginal canal through red light therapy, warmth, and vibration. So the first component is red light. And when red light is exposed to the skin, it helps to build collagen and elastin, and it helps with blood vessel formation. Now, blood vessel formation is something you're going to hear from each of these kind of components of the vFit. Blood vessel formation and blood flow are really great for sensation and libido and are really important. So it's going to help with that blood vessel formation. It's going to help the tissue to now hold more fluid, so better lubrication. And the red light helps to thicken the tissue and helps with laxity. Now, a lot of us know of red light therapy for the face. Many people on this call may use the red light therapy device. I'm a huge proponent. It's excellent. Red light therapy is also used for hair loss and pain. There's different wavelengths of light that are used for different things, but red light is extremely safe. So you don't have to worry that you're doing something that's going to become a problem down the road that you're inserting into your vaginal canal. Very, very safe. The second component is warmth. Now, warmth is going to help again increase that blood flow, and it's going to bring more oxygen and nutrients to the tissue, and that'll help the body naturally heal itself. And there's an anti-inflammatory effect to this as well, and it helps make your mucosal lining thicker. And then the third component of the vFit Plus is vibration. And vibration creates a mechanical stimulation, which helps with the development of blood vessels, same as the others, the blood vessels, the blood flow. And it has a Kegel toning effect, and that's good for better orgasmic pleasure and less incontinence. Incontinence, I don't believe that women should be made to think it's normal to wear poise pads when they're in menopause, okay? So there's things we can do about that. We need to help women to try to get away from thinking that that's the norm. The vibration also engages the pelvic floor muscles, and that helps drive heat into the tissue. You want to keep your pelvic floor healthy as you are aging and getting into menopause. So what does this device look like? This is what the vFit looks like, okay? So this is the red light portion. So when you use it, you have to be able to insert it this far. Now, it kind of looks bigger than it is, I think, but what I want to say to you is if that looks too big and you think, I am so constricted and tight at my opening that I cannot even insert that device, it's okay. This device might not be for you right now. There are other things you can do. You would talk to your doctor about vaginal estrogen. You would talk about maybe some dilators or some CO2 Lift V, which is another product that's more of a gel. These are things that I could talk to you more about on a one-on-one if you want to do a consultation with me. But don't think there's nothing you can do if you have that really tight constriction. There are things you can still do, and eventually you may want to still use a vFit device once things get better. Now, the device is made of medical grade silicone. It is not a sex toy. It is a class 2 FDA vaginal device. Okay, so it's that medical grade silicone. You want to make sure when you're using this that you don't use a silicone lube just in case it could break down the silicone of the device, even though it's a very good quality medical grade silicone, just as an FYI. So as I said about perimenopause and menopause, the vFit's going to be really great to rejuvenate the vaginal area, but there's other women who are going to do well with this device as well. If you are on birth control pills and you are experiencing dryness or decreased libido, which yes, these can be side effects of birth control pills, then the vFit could be a great option for you as well. If you're breastfeeding or you've just had a baby and your estrogen levels, your hormones are changing, you can definitely use that if you're feeling dry. If you are undergoing cancer treatments currently or have in the past, this is a non-hormonal way to help with rejuvenation. Even if you've had a hormone-sensitive cancer, you can do this preventatively, is my opinion. So if you know you're going to be going on treatment for cancer that is going to drop your estrogen, there's a good chance you're going to experience these genitourinary symptoms of menopause at that point. So you could start the vFit prior to try to keep those issues from even happening in the first place. Also, if you are having a treatment done, let's say you're having a treatment in the office here with Dr. Peters, like the FemiWave, which uses radio sonic vibration. I'm having a mind blank about what the actual modality is, but it's an external device that is used to help with orgasmic response, plumping of the labia, improved sensation, easier arousal, more lubrication. So this is a treatment that Dr. Peters does here in the office. So I think doing the vFit prior to and while you're going through those treatments is only going to enhance your results and how things last for you also if you continue to use it after having that treatment done. But ladies, if you're having pelvic or bladder surgery, I also think the vFit's an awesome choice. Again, getting that tissue as healthy as possible prior to your surgery and then keeping that tissue healthy after. So those are some of the people that might appreciate using the vFit. And what I really want to say here is do not wait. Genitourinary symptoms of menopause don't go away on their own. You have to do something about it. The vFit is one tool in your toolbox. There are other things you can do for sure. And also, lubrication is important, but lubrication and using lubrication is not going to change the tissue and resolve the issue. So a lot of people will use lubrication and they still cannot have sex. It's too painful even with lubrication. All right, so this is actually going to change your tissue and make it healthier. Also, systemic hormones are great. I'm a huge advocate of systemic hormones, and I think every woman should be educated on why hormones can be so great to replace as she goes into menopause, not just for hot flashes, but for your bones and your brain and your heart. So I'm a huge proponent, but unfortunately, sometimes that's just not enough to curb these genitourinary symptoms of menopause. So sometimes we need extra help, like with the vFit. I also just want to mention vaginal estrogen. Vaginal estrogen is an excellent tool in our toolbox for sure for helping with these genitourinary symptoms of menopause. And it is my personal opinion that pretty much most women should be on that. And I think that vaginal estrogen and the vFit are really a dynamic duo for really helping rejuvenate the vaginal and vulva area. Now, I'm going to do a talk about vaginal estrogen, and I'm really passionate about talking to you about that because I think women just don't understand the importance of it. They think they cannot use it for multiple reasons, and that just isn't the case. And so that will be my next talk. So just stay tuned, and you will see the date for that. I also think it's my opinion that because 84% of women are going to get genitourinary symptoms of menopause, why not prophylactically keep things in a healthier state? If you are, let's say, 50 years old, and maybe you weren't experiencing these symptoms, but you still could get on, say, vaginal estrogen and or the vFit Plus to keep things the way they are instead of waiting for them to become a problem and now trying to, course correct. It's kind of like we do our skincare, we've been doing that for years to try to keep our skin from aging. I think it's a similar concept. So I just want to mention that I think it's a great idea to get started, and you can even get started on something like the vFit, in your 40s or so. Now, when I say vFit and vFit Plus, they're the exact same device, except the vFit Plus is an upgrade that you get when you purchase here from Dr. Peters' office. It's the professional model. You do not pay anything extra. It's the same price, but you will get this $90 upgrade when you purchase the vFit Plus from us. Now, what do you get with that? You get a maximum of 12 minutes versus only 10-minute runtime. You get more vibration modes, and you get a 32% higher output of energy, which equals quicker results. So to me, it's a no-brainer. Don't just buy a vFit. Make sure it's a vFit Plus, hopefully from us if you decide to purchase one. So how do we use our device? First thing you want to do when you get your device is you want to make sure it's charged. So you plug it in and you charge it for about 24 hours. 12 to 24 hours. I usually like to charge my devices for 24 to make sure that they are good. Next thing you're going to do is you're going to download the JoyLux app. When you download the app, that's what allows you to upgrade your vFit to a vFit Plus. It'll sync up and give you the upgrade. So now you have the longer runtime and the higher output of energy. The other thing you're going to need is a lubricant. You want, like I mentioned before, a non-silicone lubricant. That's really, really important. The phototonic gel, which is made by JoyLux, it's made specifically for this device. And the phototonic gel is water-based. It has hyaluronic acid, it has aloe, it has safe, clean ingredients. And if you're going to put something in your vagina, you do want it to be safe, clean ingredients. It's really important. But here's the best part of all. It'll increase the efficacy of your LED lights by 40 to 45%. So again, that's a no-brainer to me. I want to make my time that I'm using this device the most efficacious that I can if we're taking the time, effort, and spending the money on it. And this device can also be used as a lube, and it's safe for sex toys too. So I'm going to show you how to actually use the device. First of all, when you download the app and you are going through the app to upgrade, you'll see that you can also run your device through the app, but you don't have to run it through the app. You can do it from the buttons on the device. That is up to you. In the beginning, you may want to follow through with the app because it might keep you on track. Because if you don't use the device, it's not going to work, right? You have to use it consistently. And this is an ongoing thing, just like if you're using vaginal estrogen, it's an ongoing thing to keep things, because if you stop, it's going to revert back to how it was. Okay, so it takes that consistency. So maybe you need that app to make sure you're being consistent. I personally don't do that. I got this before there, excuse me, there was an app. So I just do it right off of the device. So if you're going to be using the device without the app, I'll show you here. This button, it's backwards, I have to look. This is the on button. This here is the vibration mode button. And this is going to dictate how long of a runtime you have. So the first thing you want to do is you want to take your photonic gel and you want to put a small amount. Okay, you don't need much, just a small amount. Now, I like to take my photonic gel and rub it all around the area because remember, you get that 40 to 45% better efficacy. So I want to make sure it's on the light. Then bring it up around the top so that it's easier to insert. Okay. Now, you're going to turn the device on with the power button, and you'll see it lights up. Now you're going to choose how long your runtime is going to be. Now in the beginning, ladies, I know we all just want to jump to 12 minutes because we want those great results, but that's probably going to be too warm. You have to get used to that warmth. So I would recommend you start with 6 or 8 minutes. If you put it in for 8 minutes and it gets too warm at 7, just pull it out. It's okay. But you'll work your way up to using it longer amounts of time. So you'll just toggle through. The first button is 4 minutes. The second is 6 minutes. The third is 8. Fourth is 10 minutes. The last is 12. So you'll toggle through. We're going to go to 8 minutes. Now you're going to insert the device and you're going to make sure that that light is inside of you. If it's like this, it's not going to work. You've got to get that all the way in. Okay. Now you'll push this button and the device will go on. All right. And then it'll just do a runtime. It'll stop when it's done. Now the vibration mode button on this side, you can toggle through and you can see which vibration modes you prefer. You may prefer one versus the other. You may want to try a different one each time. That's fine. But you can do that while it's inserted. Now, if you go to insert your device and it takes you a moment to actually get it inserted and your light goes off, just press this again, get to your minutes you're going to use it, and then push it on once it's in. Okay. All right. Then it'll shut off by itself, but I'm going to turn it off. And when we take it out, now we need to clean it. So what I like to do personally, I use this before bed. And then I will clean it off with a tissue. And then I will use the phototonic wipes. Now, the phototonic wipes are another no-brainer to me because they're so easy. We want to make our lives easy. We want to make this doable for ourselves. And one of the nice things about the phototonic wipes is they are 99.5% effective in removing the most common germs from vaginal use. Also, they're going to help with optimal maintenance and longevity of your device. And you can keep this by your bed if you're like me and you want to do this right before bed. That's when I prefer to do it. And I don't want to get back up and go to the bathroom and clean my device. So what I do is I just keep the wipes by my bed. I will then give my device a nice wipe down, clean it, and then I like to put it back into the little pouch it came in and leave it by the bed. Now, I do not like to charge my device by my bed because I do not want any lights in the room that are unnecessary because that's going to keep you from sleeping properly. And the charging light's a little bright. So I will leave that there, and then tomorrow morning, I will take it and charge it in the bathroom. That's how I like to do it personally. When you charge it, it will last for about 3 12-minute runs. Typically, I will use mine twice and then charge it is what I like to do. And ladies, do not use these wipes on yourself, on your body. These are only meant for the device, okay? The lifespan of your device is going to be about 2 years or more. So you should get at least 2 years. The LED lights will last ongoing. It's just the device itself can only last so long. So you will get at least 2 years or more. I definitely got more than 2 years out of my device. You must charge it regularly. Like any device, if you leave it sit too long, you're going to risk that you won't be able to charge it in the future. So it's really important that you keep it charged on some kind of basis, and hopefully you're using it and then you are charging it. And you're going to use this for about 6 to 8 weeks, maybe like every other day. And then your goal would be to do it once or twice a week for maintenance after that. And the cost of the device is $395. Now, we're running a promotion until the end of next week, the 28th. If you purchase a device, you will get a complimentary phototonic gel, which is a $45 value. You're going to get that as part of your purchase of the vFit Plus if you purchase it from us. Okay. Now, I also want to mention to you, and ladies, if you have any questions, let us know. Yeah, let it put in the chat box because we're nearing the end. So if you have any questions, please let us know. Now, I do want to mention that Joylux also has an external device for healing, and that speeds wound healing by up to 6 times faster. There's a red light in that. There's also an infrared light. And that one's really great for like pain at the vaginal opening, if you have lichen sclerosis, if you are post-vaginal delivery. You can actually use it on sore nipples, or you could use it over a C-section for healing. You can use it during pregnancy for hemorrhoids. Really, you could use it on any little area that needs healing. I love the idea of rejuvenation internally with the vFit Plus and then externally with the NeoHeat. I love that. I'm a big red light fan. I have red light devices. I probably have 7 of them, one for hair and a big panel that hangs on my door. So I understand the value and benefit of these wavelengths of light. So you could do that in tandem. One night you could do your vFit Plus, one night you could do your NeoHeat. So I do like to just mention that device is $179. Couple other products from the Joylux company that I think are quite nice. They have a product called Revitalize Her, and that's an intense hydrating serum that's very nourishing. Some women get extremely dry externally and they're very uncomfortable, or they just like the idea of moisturizing their vulva area. And the Revitalize Her is a lovely product for that. And you could actually use it anywhere for hydration, to be honest. And then there's the She Bar. That's a moisturizing cleansing bar, and it is safe for your delicate vulva tissue. But you can use it full body. It's lovely. It has a very light mandarin scent, and that is a very nice device. I'm sorry, a nice product by the Joylux company as well. And you will get if you're the winner of the raffle basket, you will get a She Bar, you'll get the Revitalize Her, and you'll get the phototonic gel and the wipes, which is really, really wonderful. Are there any questions? Let's see. Let me just look here. I don't see why you couldn't use your vFit during your menstrual cycle. I don't think there's anything that it would do. Who knows? It may even help with cramps a little bit if with the heat and the warmth, it may feel good. So I don't see any reason why you couldn't use it during a menstrual cycle. Is that the only question? Okay. All right. So, ladies, if you do have any questions or if you have any comments or feedback for us, I really want to bring you more information on sexual wellness and eventually more just on menopausal wellness in general. So if you've got any feedback about how you would like to receive this information, I would love for you to email me. My email is jderr, it's JDERR .hormonewellness@gmail.com. And I'd love to hear from you if you would prefer webinars where you come at a specific time and we have a specific topic, or would you prefer maybe pre-recorded webinars that you can just watch at your convenience? Or maybe you would prefer to come in a small group and we just do an educational time where, I teach you about different things and you can choose to ask questions or not. Or maybe you prefer more like a course that you would purchase a course and you could just watch at your own convenience. Let me see, there's another question here. What is your email again? Here, let me type it in for you. It's jderr.hormonewellness@gmail.com. So yeah, please do reach out to me. Oh, there's more questions. Let's see. Is the device only for those that experience pain? No, the device would be for someone who experiences maybe some dryness, maybe a little leaking, a little bit of incontinence. It can be, again, a little prophylactic to try to keep things healthy. Many of us use red light therapy prophylactically, right, on our skin to try to keep our skin as rejuvenated as possible. So, yes, you could be thinking of it in the same way, that you're just trying to keep that vaginal skin healthy so that it stays lubricated and has more elasticity and keeps you feeling good. Can we have sexual intercourse? Yeah, absolutely. My thoughts on that, it's probably going to get things warmed up and the tissue is going to feel better. And yeah, absolutely. I think having sexual intercourse after using vFit is great, especially if you do have a little bit of discomfort, or that might just kind of help get things a little more prepared. So that's a great question. Yeah, absolutely. You can see this device in person if you come see Dr. Peters, or you just want to pop in when they're here, you can look at the device. It does look larger on camera. Okay, so maybe that gives a little better perspective. But it's not overly large. If you think about the average size of a penis, really, this is not an overly large device, honestly. But I know it does look big when I'm holding it up here. So maybe that's a little better perspective. or use my hand to kind of show you. Maybe that helps a little bit, right? Okay. Any other questions before I tune off here? Again, I'd love feedback from you all. And if you're interested in the device, we'll run this promotion till the end of next week. That's the 28th of February. You just need to call the office and we can set you up with your device. And I need a lot. Okay. Can I do this after I use the device? Yeah, absolutely. Are you asking me that if this is going to help you orgasm better, or are you asking me if you can have oral sex and things after using the device? If you can clarify that question for me. But I'm going to say that using the device is going to help orgasmic potential because it's bringing more blood flow to the area and more sensation. And if you use your device first, yes, I would clean the gel off externally, but remember it's very clean ingredients, hyaluronic acid and water and aloe. So yes, you can. I just want to be able to have, yes. Um, I would say that there's potential for this to help with that. And so it is not bad to ingest. I would say not in the amounts. If you use your vFit and you take a tissue and you wipe away the excess, I would say that it should be absolutely fine. I do not know if it's been helpful for tailbone pain. I think if you have tailbone pain and you haven't been able to ascertain what it is, maybe a pelvic floor therapist could be helpful for you because they can really address pain in that whole region. And many times it has to do with what's going on with our pelvic floor. I can't say for sure if it would help your tailbone pain because I don't know exactly why you have that. Yeah. Okay, ladies, any other questions quickly before we head off? I think that's it. I really appreciate you joining us today, and I look forward to seeing you more in the future. And I hope you'll join me. I really am excited to talk about vaginal estrogen because I hear so much misinformation about it, and women do not understand what it can do for them and the importance of it. So I'm excited to bring you that as my next talk, and we will send out a date as soon as we have it. Thank you. Thank you all so much. I appreciate. You're welcome, Ashley. Thank you so much for showing up today and giving us your time. We really appreciate it. Okay, bye everyone.